I'm going to give you under various categories. I'm going to explain you under different categories. Yeah. So I'll be going on speaking. Sometimes my throat gets wet, so I'll be just wetting my tongue. It's not having tea or something like that. It's just keeping my tongue wet so that I can go on speaking without any difficulty. That's the only reason. Okay, fine. All right. Okay. Rule number one, nobody is going to start the video. Rule number one, no one is going to start the video. And if anyone notices, you can just send me a message on my WhatsApp. Okay? Because I'll be focusing on teaching and I'm not going to bother many things. I don't want anybody to be lying on the bed or cooking in the kitchen and opening their video and showing what they are doing. Okay, we don't mind all those things. Right. So, if possible, I have sent the link. If you have got, you can send it to your friends' links or in the other groups because I don't have much time to send all those things. Right, there are 21. Yes, here we go. A score. It's 20 people. Plus Simon. Right. So here, you need two people to partner for speaking. You need two people to partner for speaking. Yes. Right. Yes, good evening, everyone. So we need a partner to speak. Right. Now, and second thing is nobody will open the microphone until, yes, good evening. Nobody will open the microphone until and unless I name them. Okay? Right. Mute all. Okay. Now, phrases in speaking. Phrases in speaking. What are phrases and what are clauses? What are phrases and what are clauses? We know these words, but what exactly they are, a number of students don't know. So let's learn about phrases today. Phrases means what? What do you mean by phrase? What do you mean by phrase? Now let us see. What do we mean by phrase? The word phrase. What does it mean? Phrase. Phrase means what? What do you mean by phrase? Now let us go to phrase. Cambridge Dictionary defines a phrase as what? Phrase. Now the phrase is a noun, name of a group of words that is part of rather than whole of a sentence. Right. Now let us see what the actually. Now you can go through these. This is very, very important topic I'm going to tell you. Don't take these things very lightly. These are very, very essential aspects. Right. A phrase is a group of words that is part of rather than the whole of a sentence. A group of words in a sentence. A group of words in a sentence. A part of the sentence rather than a whole of sentence. A part of a sentence, one particular part of the sentence, a specific part of a sentence. It's not the complete sentence, but it is a part and parcel of a sentence. And now we are not learning just phrases, we are learning special phrases. Special phrases. Not any phrase that any Tom, Dick, and Harry can speak. That doesn't make any sense. We're bothered about the special phrases. Now, what are these special phrases and why they are important? A group of words that is part of rather than the whole of the sentence. Now, how come we identify that these are ordinary phrases and special phrases? Now, special phrases are those phrases which repeatedly occur almost always. Now, repeatedly occur, that is called reoccurrence. Reoccurrence. For example, in the meantime. In the meantime. That means now I am here. Now I am here. I'm teaching. And you ask me, we'll go to the market. We'll go to the market. But I'll tell you, I have a lecture right now. It will take another hour. And now, after an hour, okay, we'll set out for shopping. We'll set out for shopping after an hour. But in the meantime, can you please be silent and do not disturb me so that I can continue my lecture? You can carry out your personal work if you want, but please do not disturb me. That means from now on to the time we are going to set out, in the meantime, that means in the time between now and then, this period is called in the meantime. So in the meantime is special phrase. Like that, these carry weightage. Weightage. What do you mean by weightage? Weightage, carriage, marriage, passage, usage. Pronunciation matters most. Speaking, in addition to grammar and vocabulary, pronunciation is also included. Pronunciation is also included. It matters a lot. If your pronunciation is not up to the mark, the other person, the listener, cannot comprehend your message. He cannot digest the subject that you are conveying. A number of different words you can learn. You can go to the audio. You can revisit the audio, which is on the YouTube later. You can revisit later the YouTube lecture, and you can note down the words which I am speaking. Revisit. Okay. Conveying means message, telling, speaking, passing on. imparting. So, number of words will come, and you can write down the words if you feel that these are something special, and those words you are not using in either speaking or writing. That means they are passive vocabulary. Passive vocabulary. Now, what are active vocabulary and what passive vocabulary? Actively, you are using. When you are using them actively, that means you're speaking out or you're writing them onto the paper. Then that means they are active vocabulary. That means action. You're doing, you're speaking or writing. So productive skills. When the words are used in the productive skills, they are active vocabulary. And when the words are used in the receptive skills, they are passive vocabulary. That means only they go into your brains. They don't come out of your brain. That's it. So passive vocabulary, that means they are passed on to you. Active vocabulary, they are passed on from you. Active vocabulary are going out. Passive vocabulary are coming in. Passive vocabulary, active. So transform this passive vocabulary into active vocabulary. Dynamic progress. Dynamic progress. Now, how are you going to use them? That is what I'm going to tell you. I hope you understand the intensity of the lecture. Are you with me? Are you with me? That means, am I clear? Is everything understood? Please don't raise your hands. Just message in the chat box. All of you. Chat box, message in the chat box. Because only at the end of the session, there's a chance of question. This is a lecture. This is a lecture. If anything is there, you can just write it down and I can notice there. That's what it is. Are you with me? So yes or no. That's it. The phrases that you're going to use, learn here. If you can use 20 phrases, you are going to shoot your marks to the sky. That means you're going to enhance your scores. More than that, you are enhancing your skills. That's the important aspect. A group of words that is part of, see here, a group of words that is, not that, those are. So it's not word, a group that is part of, a group of words, not words are part of, a group that is. Be careful with your grammar. Okay. So now that is the sentence. For example, if you say, take one sentence here, one example, what is a phrase? A sentence is made up of number of phrases and clauses. So now a sentence and a phrase. Now let us take what is a phrase here. I'm going to teach you a number of phrases. I'm going to teach you a number of phrases. Now we are going to begin and we'll end after an hour. In the meantime, make notes of all the phrases that I'm going to use in the lecture. I'm going to begin the lecture and this is going to continue for the next 1 hour. In the meantime, comma, you can make short notes on the phrases provided. Now here, I'm going to begin the lecture. I'm going to begin the lecture, and this is going to continue for the next 1 hour. This is going, and this lecture is going to continue for the next 1 hour. In the meantime, so what is this meantime? Now let us see here. Meantime, is it one word or two words? That's it. So in the meantime, so we are going to learn a number of things. In the meantime is a phrase. It's a phrase. Right. Fine. In the meantime is a phrase. And it is starting with a preposition. In the meantime, starting with a preposition. And the main one, meantime, is the noun. So, according to the words in this phrase, it may be termed as a verb phrase, adverb phrase, adjective phrase, noun phrase, different names they have. So we are not bothered about all those things now. I'm just giving phrase means what? Phrase means what? Yeah. Now, in the meantime, so here, try to understand this part. You can use this one. You can use this one. Okay. Let me tell you one important thing. Of course, I totally agree with you. You are anxious regarding your child's health. According to my observation, the condition of your daughter is absolutely stable at the moment. At the moment. And therefore, there is no need to be upset. The doctor is going to come within another 10 minutes or 15 minutes at the most. In the meantime, can you please relax? So that I can prepare. I can check the vitals of your daughter. In the meantime, I can prepare everything ready. The doctor. I'll take the necessary vital signs, vital, whatever we do those things, and make notes of those things. And I prepare everything ready. When the doctor comes, and straight away jump into action. So in the meantime, can you please sit down and be relaxed? Calm down. I totally agree with you. If I were in your position, I would have definitely felt the same. But, so, in the meantime, so this is a phrase. This is a phrase. Now, what is the difference between phrase and a clause? In the meantime, for example, if you say, in the meantime, yeah, I'll tell something. In the meantime, you'll be waiting. What is it going to tell? In the meantime, yes, sir. In the meantime, what next? Continue. That means it is incomplete. A phrase is incomplete. It's not complete, it's partial. It doesn't have complete sense. It has a sense, but it doesn't make complete. In the meantime, what? In the meantime, what? It's incomplete without the extension. In the meantime, you sit down and relax. So that is very, very essential for this one to give a complete and concrete sense. So a phrase has meaning, has order, has a sense, but it cannot give complete sense without the remaining part of the sentence. Now, what is a sentence? Now, let us see. Okay. In the meantime, you can make short notes on the phrases provided. Now, see, in the meantime, you can make a short notes on the phrases provided. So, this is complete sentence. But now, if you remove in the meantime, there is another part of the sentence. You can make short notes on the phrases provided. Now, I'll make another phrase on the short phrases provided. This is another phrase. On the short phrases provided. What on the short phrases provided? What on the phrases provided? On the phrases provided. What? On the phrases provided. What? How many times I tell you there is no on the phrases provided? What? It doesn't make sense. But if you take this part of the sentence, you can make short notes. Now, this part of the sentence, there are three parts of the sentence. In the meantime, on the phrases provided, and you can make short notes. But if I say, you can make short notes, you can make short notes, you can make short notes, absolute, absolute. You will say, okay, sir. You can make short notes. Yes, sir. Okay, sir. Now you understand what's the difference between a phrase and a clause. We had to learn in the 5th class, 6th class, 7th class, the high school itself. We did not bother, and we are learning now. That's important. That's important. So, is that clear? Now the question is, right. So, phrases / clauses. So, is the difference clear? Yes or no? Clarity. Is it clear or no? Just hit your button, yes or no. Because we are moving forward. Because we are going forward with the phrases. Now you understand what is it. If I tell phrases, I'm giving you some phrases. Everyone will say, I'm giving you some phrases, and they give phrases. But what are phrases? Instead of borrowing phrases, why can't you create your own phrases? That's strength. I'm trying to give you strength. Remember, you are not a beggars to borrow from somebody else. You can create. You are producers. That is what I'm going to transform from beggars to producers. Every time, sir, give us some important phrases in speaking, sir. Give us some phrases, sir. Give us some sentences. Give us some bits, sir, which we can use. How does that sound? Oh, come on, sir. Very nice. Wonderful. Oh. We don't know the meaning of how does that sound, but we feel, oh, wow. Okay. So that's it. Borrowing from somebody. Somebody tells some sentences, we'll write. From somewhere, we'll write. No, we have to create our own styles. We have to create our own styles. For example, is another phrase. For instance, is another phrase. For instance, is another phrase. For example, is another phrase. Okay. So we are going to jump into action. Build your lovey-doveys here. Bring your darlings here. Bring your bosom friends here. Because we are rerouting our destination. Rerouting our pathway. Put in your friends. Yes. Put in your friends. Right. Come on. Yeah. So, you can invite your friends. I'm giving you some phrases. Phrases for speaking one. Recreating history. Recreating or reinventing phrases. We will be taking number of phrases from others and will create our own phrases. That is the matter. Yeah. Now, first thing is when you are explaining something. So first part. A. So, what is the motive? Motive. Motive. What is the primary motive? Primary motive. What is the primary motive? Please don't be selfish. Invite your friends. Let them also enjoy with us. We are 25, silver jubilee. Why don't we make a golden jubilee? That is 50. Yeah. So if not, I have to go. You help me. Otherwise, I have to go and send to all the groups. All right. Right. Primary motive. What is this motive? M-O-T-I-F. Motive. Motive means a pattern or a design. Okay. A pattern or a design. An idea that is used many times in a piece of writing or music. A pattern or design. A motive is also an idea that appears repeatedly in the work of an artist or in a piece of writing or music. So that's it. Okay. Or you can just so we are going on telling. Okay. For example, we are explaining things, our motive. Okay, which is repeatedly happening is we are explaining things. Okay. Right. We are explaining things. So we are providing an explanation. Explanation. Explanation, not explanation. It's explanation. X, not X. It's X. We are providing an explanation. What is this, sir? You are saying explanation. Everyone says explanation. It's not X, it is X. Okay, fine. 90% of the words pronunciation we do not know, we do not pronounce properly. That's the main reason why we're not able to follow the standard pronunciation. Okay, now let us see. This is a family of X, not X. Okay. Right. So let us see the base word. Yeah. Right. So it is X, not X. This sound is I, not A. This is sound I, not A. Remember that. This sound, what he is showing you here, this sound, this is I, as in pin, 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 same sound, I. You want to see? Just check the sound. I will show you everywhere. Pin. So pin, this is I. If you accept it or not, that is not my problem. If you do not know, learn it to die. Learn it to die. Your marks will increase by 50. Your marks will increase by 50. Pronunciation matters the most. Right. Pin. I, I, I. Then, for example, the sound. These are sounds. These are not letters, my dear. These are not letters. I am teaching you phonetic language now. The sounds of English, the sounds of English, letters, phonetics. This sound, this is P, this is letter P. This is letter P, whereas this is sound P, 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 P. This is not P, this is P, 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 P. That's all. It has no, unless and until it takes a vowel, the sound cannot come out. And if I is there, it becomes P. If U is there, Pu, like that. So unless and until it is associated with a vowel, the sound cannot be heard by the others. It's closed sound. Closed sound. And vowel is there, it will extend. P. Otherwise, it's P. Okay, those are only starters. Okay, short, very short consonants. Very short. Okay. Now, this sound is E. Now, let us see. P, E, E, L. Now, what is this sound? This is E plus E. So, these two dots means prolonged sound. E, E. So, now you can understand what is the sound here. This is E. The same thing, E. But with the two dots, it becomes, that sound and this sound is the same. But this sound has two dots here in between. So it is P. So this sound is E. Okay. For example, R-E-A-D. That also same sound, E. Now, don't think that the sounds are same with the letters. Now let us see. S-E-N-D. This is send. This is A. This is A. If the letter E is there, you should pronounce it as A. Sa-e-na-da. Send. So the pronunciation. So, right. Exam. Now let us see this. Is it exam or exam? It's ig, not egg. Exam, exam.
Exam, 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 exam.
Exam, exam, exam.
So that's it. So pronunciation matters the most. So fine. Now, explanation. We are going to give explanation. Right. Whenever you are going to give explanation, now let us see. Number one, The first one is what? Yeah. So let us take the first example. Okay. The reason for. That's okay. But the main reason for, so the reason for, so when you're explaining something, you'll say the reason for this is, you're giving explanation. Why is this happening? You're explaining why. The reason for this is. Come on, write down one sentence, all of you. Action. 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 Write down one sentence each. The reason for. Doctor, why are you giving me blood? Why are you giving me blood? Doctor, why should I take insulin injections? Doctor, why is it hurting too much? Why am I unable to sleep? Think about any question the patient asks. Imagine and write your sentence. Imagine and write your sentence. 1 minute. Write in your notes first and then type here. Yes. So the reason for. Write down your own sentences, because these sentences you are going to use in the speaking, because he will definitely ask, definitely somebody will ask, why should I take this medication? Why should I not go home? Why should I not stay here itself? In the house, nobody is there to help me. Why are you forcing me? Why are you discharging me? I want to stay here for some. So give the reason, give the explanation why. So 1 second, please, all of you, 1 second. Are you ready for a serious practice? Stay here, otherwise go and sleep. Are you ready for a serious session, serious practice, not a passive listening? That's all. Are you ready for a serious practice? Say yes if you are ready. Otherwise, go and sleep. Just to go and sleep. No, I don't have any benefit if you stay here, if you do not stay here. I don't have any practical benefit. It's benefit for you. If you are ready for participating, I want you to say yes or no. Then only I will. First, second. Your name, please. Again, second time I am asking. Second time I am asking. Third time I will ask. That's the last time. Then afterwards, because I will remove from the Zoom, means never again anybody can enter, but that will be totally blocked. So that's why I'm giving 3 hints. 3 times I'm saying, give your name, give your name, give your name. Once I remove, no, again you cannot enter, because that will be blocked by Zoom itself. Say yes or no. Right. Okay. Very good. So we have 26 candidates. Yes, Rubina, you can write down here anything because I'll not open the microphone now. Only at the end of the session, I'll be opening. Whatever it is, you all have to write here. That's all. Yeah. Yeah, you can type here, please. Type here. Type here. Okay. Type here, all of you. Yeah. Now, give a reason. My question is, the main reason is, the fundamental reason is, this is because, instead of the reason for, the fundamental reason, the main reason, the primary reason, the basic reason, you can add anything your style and you give full sentence. I'm just giving you phrases. Use this phrase and write your own sentence. If you cannot do it today, you can never do it. Remember that. Come on. Yes, now start. So many students said yes. So you go ahead. There you go. The reason for, I'm taking the sentences. I'm going to read those sentences and I'll tell you whether it is right or wrong. And as far as possible, try to write capital letters. Chandan, you did not put a capital letter. Nurse, comma, why are you giving me excuses? So that's a question. So capital letters, full stops, commas also check. Because in your writing, it will be helpful. I'll be checking your sentences. Right. Yeah, I'm folding my hands, sitting back and relaxing. I'm enjoying the show. I am the umpire. You are the players. Come on, dance the show. Dance the show. Yes. I'm inviting some people, other people, because you're not taking the responsibility of inviting some people. So I'm sending it to the others. Okay. Come on, go ahead. I can take the YouTube link also along with this in the future. Yeah. Come on, start. Action. The question is already there. Statement is already there. So, Chandan, not all capital letters, only first capital and last full stop. I did not say you to write all capital letters, only the initial capital letter. Chandan, you took me wrong. You did not understand what I was telling you actually. Only first capital letter. Okay. You did not write. That's why I told nurse and capital letter was not there. That is what I told. So, please. Here. Come on, start. I want to see. Okay, those who are writing all these things will be given chances for speaking sessions. One-on-one, live. Share your Telegram. Yeah. Why it is taking, sorry, why is it taking Binsimol? Sentence, correct your sentence. Why it is taking long time? Why is it taking a long time to administer medication? Why? Question will not come, it is. Question is it? Why is it taking a long time? Two mistakes in your sentence. Sir, I cannot hear you again at all. Esther, exit and join. Rewrite the sentence, Binsimol. I want your sentence to be rewritten, please. Rewrite it correctly. Yeah, why is it taking a long time to administer medication? That's awesome. Chandan, am I audible to you? Yeah, correct sentence. But question mark will be immediately, not after a gap. Correct it. Rule, punctuation. Punctuation rules. Is there any regular student who can make the points? Yeah. Yes, there are some. Okay. So, Smita Kant, Meera Manoj, Binsi Mol. Yeah, these three students, regular students. Okay, bless. Write down the points which I am telling you. Okay. Yeah, that's corrected. Am I audible to you? Am I audible to you, Chandan? Absolutely right. Okay, I like your response. Immediately correcting the sentence. Sergeant Wavilla, what is the reason for checking the vitals? Three mistakes. W capital letter was the reason for checking the vitals. The vitals. After vitals, no space. Question mark directly. Three mistakes. Correct and write it again. W capital letter, the vitals, and after vitals, no space. Nishi, okay. Nurse, comma. How much time do I have to wait for the doctor? Doctor, no need capital letter. Doctor, full word you have to write, not a DR. There is no shortcut allowed. Just write doctor. Nurse, how much time do I have? Not I have. Do I have? How much time do I have? Question this is. This is a question. Definitely the do verb should come here. Helping verb do should come. Do I have to wait for the doctor? Write down correctly, Nishi. Okay? Write down correctly. I want you to write correctly. So, nurse, how much time do I have to wait for the doctor? Others also. Note these points which I'm telling you. These are correct sentences which I'm telling you. Okay? So write down so that you can use them properly. Ullas Francis. I will not read any direct message coming to me. I will ignore because everyone should see them. Everyone should see them. So that message is ignored. Ullas Francis, your message is ignored. You write it open to everyone. Then only I will see because, yeah, I want you to participate openly. Right. Yeah, very good. That's it. Next one, Nishi. Nurse, comma, after comma, space should be there. Nurse, comma, space. How much time do I capital letter again, comma, space. Nurse, comma, how much time do I capital letter, have to wait? Do I have to wait for the doctor, question mark. Again, mistakes are there. Comma, space is missing. How much time do I capital letter, second mistake. Have to, another mistake, to is missing, to wait for the doctor, question mark, question. Four mistakes in your sentence, Nishi. You have to correct it out. You have to correct it out. Then Chandan. Is it okay for you, Mrs. Nisha? Is it okay for you, Mrs. Nisha? Okay, question mark, Mrs. Nisha, question mark. Is it okay for you, comma, Mrs. Nisha, question mark. Yeah, next one. Ullas Francis. Nurse, comma, how long I want to take these medicines? I want, you want means, how can she tell you that how long you want to? I have, how long do I have to take these medications? Sentence is wrong. Okay. How can she say how long you want? You want, you should say. How can the nurse say how long you want to take? You want is your want. Okay. Need is there. That is different. You want is different. Need is different. Okay. How long I need? Do I need to take this medication? Not want. Want is from you. Need is from, okay, necessity. So nurse, comma, space. How long do I have to take these medications? Do I need to take this? Do I require to take these medications? Do I need, not want, need to take these medications? How long do I need to take these medications? Correct the sentence. Will you be able to follow my advice? Will you be able? I'm giving you sentence corrections. Will you be able to follow my advice? I don't know what is going on. Full stop. I don't know. Don't. Yeah, FIGA, don't. DON apostrophe T. I don't know what is going on. I don't know what is going on. This is speaking. You don't know. It's already told that it is speaking and everything is written there. Are you asking me or you're telling a sentence? So definitely you're asking me, I can understand because you don't know what's going on, maybe. So I don't know what is going on. So this is speaking session going on. The phrases for speaking are explained here. So read there. The next one. Nurse, why no one is bothering my condition? Bless Jose. Nurse, immediately comma, number one, comma, before comma, no space. Nurse, comma, why is no one bothering about my condition? Why is no one bothering about my condition? Why is no one bothering about my condition? What? Nobody is writing sentences. See, this many people are writing sentences, I'm telling, but you're not able to give me, one person, you're not able to give me food to eat. What you're doing? You want to make me lazy? Come on. So better I'll invite some other people who can be active. Yeah. Bill, bless Jose. Nurse, why is no one bothering about my condition? Okay. Thank you for your condition correction. Thank for your correction. Thank you for the corrections. Okay. You're not giving me enough food to carry on. You have been diagnosed with migraine. Chandan, migraine spelling, mistake. Migraine, full stop, before full stop, no space. After full stop, there is space. So 3 mistakes there. You have been diagnosed with migraine, RAINE, full stop, no space before full stop, and space after full stop. So A is missing, 1 mistake. Space before full stop is another mistake. No space after full stop, that is another mistake. Are you aware of that? That's correct. Vincimol Thomas, nurse, comma, how much time does it take to transfuse blood? Full question mark. So there are 2 mistakes in this Vincimol Thomas. Nurse, comma, space. After every comma, there is a space. Right. So the next one, how much time does it take to transfuse blood? Very good. And question mark, before question mark, no space. That's a mistake. Before question mark, will you able to do that? Question mark, very good, that's fine. Yeah, next. Okay, that's done. So only 1 sentence you are able to give. You're not able to give more. Then the second sentence, okay. The second one. So second. Right. So you can give the example like this. One possible explanation for that is, one possible explanation for that is, okay, one possible explanation for that is, So you can say there are many reasons. One possible explanation for that is, you can say like that. One possible explanation for that is, so you can give one sentence regarding that. One possible. Are you following me, Mr. Chandan? Yeah. Are you following me, comma, space? Before comma, space. After, before comma, no space. After comma, space. Okay. So, Sergeant, does this sound realistic? Yeah. Does this sound realistic? Does this sound realistic? No need is, because does is already there. Does this sound realistic? Does this sound realistic? Is not required for that. Next, Sergeant, is, I capital letter. Is it necessary to follow your guidelines? I capital letter. Are you following me, comma, space, Mr. Chandan? Please let me know. Please let me know how I may assist you. Okay, please let me know how I may assist you. This is not a question, actually. When you say please let me know, it is a request. Okay. It's a request. So if you do not write please let me know, then how may I assist you is right. Okay. But because you are saying please let me know, okay. Pollen might be the cause of your allergy problem. Pollen might be the cause of your allergy, for your allergy problem, not of your allergy problem, for your allergy. Pollen might be the cause for your allergy. Reason for your allergy, not of your allergy. For your allergy. The reason for your allergy is this, pollen. So, how many cigarettes, Nishi, cigarettes spelling you do not know. SICIGA. And I told you before question mark, no space. How many cigarettes, CIGARETTES, cigarettes do you smoke in a day? Question mark immediately, not space. I'm glad that you are following me. Full stop. Very good. Correct sentence. I'm glad that you are following me. That's fine. Awesome. Yeah. I'm glad that you are following me. That's awesome. Yeah. Write one or two sentences. Don't just stick on to one sentence. And next. Yeah. I would be extremely pleased if you could explain me your present feelings and concerns. That's very fine. I would be extremely pleased if you could explain me your present feelings and concerns. Good sentence. I would be extremely pleased if you could explain me your present feelings and concerns. No mistake. Yeah. Next sentence. Next point. Right. Next sentence. Number 3. Number 3. Number 3. What is responsible, what is responsible for this effect is, what is responsible for this effect is, what is responsible for this effect is, definitely what is responsible for this effect is, the thing which is responsible for this effect is definitely your carelessness, your negligence towards the dietary patterns, you're not being active, laziness, whatever. What is responsible for your failure is undeniably lack of preparation. What is responsible for your failure is definitely lack of preparation. If you are not passing the exam, I'll say like this. In the same way, what is responsible for this effect is definitely not eating in time. So write down one sentence. Take your own time in writing. No problem, no hurry. Yes, please. Learn how to use this. No problem, do mistakes, I'm there to correct you. If you're not ready to learn, then how will you perform in the exam? Take 1 minute for each sentence, no problem, you have to digest. Participate, please, participate. So those who are participating in these questions, tomorrow I will take speaking sessions for them. Yeah, what happened? Nobody is writing any sentence. Yeah, most probably your delay, your daily diet pattern is contributed to enhanced symptoms of this condition. Okay, most probably your dietary pattern is okay, most probably M capital letter Rubina. M capital letter most probably, comma, M capital letter most probably, comma, your daily dietary pattern, not one pattern, daily dietary patterns. Okay, is contributed to enhanced symptoms of this condition. Dietary patterns have contributed to, not is contributed to, have contributed to, COM, not is, have, not is, have. I'll correct these sentences afterwards. Okay, have contributed to enhance symptoms of this condition. To enhance the symptoms of this condition, full stop. Simol, what is responsible for your obesity? What is responsible for your obesity is definitely, what is responsible for your obesity is definitely your binge eating, not binge, binge, B-I-N-G-E, binge eating, binge, B-I-N-G-E, binge. Binge eating. Binge eating, eating a lot of food, especially without being able to control yourself. Binge eating, not binge. So you learned a new spelling. So binge eating, binge. So binge, no need of binge eating habits. Okay, stress is responsible for your headache, Mrs. Nisha. Stress is responsible for your headache, Mrs. Nisha. So always take the name of the person before, Mrs. Nisha. Stress is responsible for it. So Mrs. Nisha is important. Why are you taking it to the last? You are taking the name of a person, you will take it before. Kamlesh, the reason for poor control of your glucose level. The reason for poor control of your glucose level is non-compliance with insulin medication. Very good. No mistake, no flaw. Flawless. Till now, I have seen 2 sentences which are flawless. Yeah. Excessive alcohol consumption might be responsible for my obesity. Very good sentence. How can I join the Zoom meeting? Hello, hello, hello. How can I join the Zoom meeting? I should explain him how to join. Okay. Excessive alcohol consumption might be responsible for my obesity. Fine. Correct sentence. Very good. So now, slowly, correct sentences are coming. Yeah. Now, next point. Number 4. Number 4. Point number 4. Point number 4. Let me explain. Let me explain the actual. Let me explain the actual situation. Let me explain the actual situation. And you can continue. Let me explain and continue. Let me explain. Can I please explain the situation? Anyway, you can make a sentence. Just make a sentence. Venkatesh, Ullas Francis, Sibanda, Smita, Shaila, Sajan, Rubina, Ram, Norina, Rajalakshmi, Nisha, Meera, Kamalesh, Israel, first, second. Last time I'm asking. And if you don't get the name in another 3 minutes, first, second. So, first, second, this is last request and no more. I change your name to last request. Try to understand the importance. I want everyone, please come with your original names. I'm requesting for so many times and you are not responding. How is that? Huh? Yes. So if I am removing from the platform, that means you can never again enter the platform. That's the problem. Okay. Just type your name, please. So let me explain how the disease spreads to others. Let me explain how the disease, singular, Kamlesh, disease spreads. Disease is singular, spreads to others. Okay, let me explain how the disease spreads to others. So rewrite the sentence. Sergeant Wavilla. Sergeant Wavilla. 5, 4, 3. Last request, I am putting you into the waiting room. 3, 2, 1, and done. Gone to the waiting room. Okay. So, let me explain how to inject insulin injections. Yeah, Figer. Yeah, very good. Let me explain the possible risk factors for hepatitis. Kamlesh, rewrite the sentence I told you. Okay. Let me explain the possible risk factors for hepatitis. Very good. Full stop. Let me explain you, Miss Nisha. One of our doctors, Chandan, one of many, not one of one. There are many doctors. One of those doctors, plural, not one of our doctor. It is one of our doctors. One of our doctors, many, one of many, will get in touch with you. Or you can say a doctor will get in touch with you. If you have any doubt, you can write a doctor will get in touch with you. Or the duty doctor will get in touch with you as soon as possible. You can say at the earliest. As soon as possible is another phrase. So everyone is giving phrases here. Okay. As soon as possible is one phrase. At the earliest is another phrase. As soon as possible is one phrase. At the earliest is another phrase. Yeah. Next one. Let me explain how to inject insulin by yourself. Okay. How to self-inject insulin by yourself. Yourself is one word. By yourself. Yourself is one word. Let me explain how to inject insulin by yourself. Mrs. Jacob. Okay. Next, Meera Manoj. Being overweight is one of the causes. Very good. One of the causes of shortness of breath. One of the causes of shortness of breath. Full stop. Full stop. Moreover, carrying extra weight predisposes you to health problems. Okay, moreover, avoid that word moreover in writing, but speaking. So if they are telling avoid in speaking, writing, then avoid in speaking also. Na? Okay, moreover, it's just like not very, okay. You can say additionally, you can say. Okay, additionally, instead of moreover, you can say additionally, that's better. The formal. Carrying extra weight predisposes you to health problems. Okay. Let me explain how the disease spreads to others. Let me explain how the disease is contagious. Instead of spread to others, The word contagious carries more weight. Spreading to others, anybody can say. Contagious. Contagious means spreads from one person to another. Contagious. What is the power of the word? Let us check. Contagious. See how I am using this word. You are a doctor, you should use this word. Contagious. Contagious. Contagion is formal. Contagious. Contagion is noun. Contagious is formal. Very special word. Meaning of contagious is not in English. Then where it is? Okay. Let us go to grandfather now. Now, who is this grandfather? Merriam-Webster. Okay. Word lovers. Contagious. Contagious. Okay. That is transmissible by direct or indirect contact with an infected person. Means from one to another. Okay. So you could have used this word, you are a doctor. And definitely you could have used this word, and that gives more marks. So what you have written is correct. No doubt it is correct. Ah. Who is this? Lives alive. Okay. Name, please. Who can see your message recording? Okay. Name, please. Lives lives. Name, please. Right. Let me explain. Let me clarify the health. Okay. So let me. Okay. Rubina Kamlesh. Yeah. Would you mind, Rubina, would you allow me to explain you the actual reason? Question mark. W capital letter, Rubina. Would you allow me to explain you the actual reason? Let me explain, Ms. Nisha, why anesthesia is mandatory for you. Full stop. Very good. Then Dr. Farid. Multidisciplinary team approach will be taken in this condition. Multidisciplinary team approach will be taken. Approach will be taken. Approach will be used. Okay, will be taken in this condition. Fine. Okay, you have written there afterwards. Let me explain how the procedure will be performed. Full stop. Let me explain how you can overcome. Overcome means from only. Overcome means come out of. Okay. Overcome means come from. So from is not needed. Ullas Francis. From is not needed. Let me explain you. Let me explain how you can overcome. Let me explain you how to overcome. How you can overcome from this. Let me explain how you can overcome from this condition. Okay, fine. That's fine. That's fine. Full stop. Let me explain why it is important to take your medication as prescribed. Full stop. Yes, Sivanda. Faiga. Let me explain how to book next visit. The next visit. Whenever next is there, write the next, the later, the first, the second, like that. Next is only one. So the next visit, definite article. Let me clarify the health benefits of exercise, Kamlesh, as it is necessary to keep your cholesterol levels under control. Very good. So please give me your name in the waiting room. They did not give still. Let me explain the benefits of taking vitamin D supplements. Let me explain the my patient condition. The is there, so my will not come. My is there, the will not come. Venkatesh. Okay, let me explain the patient's condition, or let me explain my patient's condition. Apostrophe S. Anyone use the or my, and patient apostrophe S. Condition, please. Doctor, DOCTOR, no capital letter. No capital letter, small letter. The next point. Okay. Second time lives life. Name, please. Okay, he's not in the meeting. No problem. Okay. Right. Next point. Number 5. Number 5. There is no doubt that there is no doubt in my mind that. So this is the sentence you may use, but I will use different word. I'll use one word instead of all these things. I'll tell you those things later, because you are not ready for those things now. There is no doubt in my mind that you can recover from the situation. There is no doubt in my mind that you can recover from this situation. There is no doubt in my mind that you are not taking the medication. There is no doubt that you are not taking the medication. That means I believe that you are taking the medication. So there is no doubt that. So 1, 2, 3, 4, 5, 6, 7, 8. There is no doubt in my mind that. You will use 8 words. I will use only one word. Can anybody use one word instead of these 8 words? Please. Can anyone give me one word as a substitute for these 8 words? Remove these 8 words and tell me one word which is enough for these 8 words. Somebody has written his word here. Believe. Sorry. One word. But please, network is so bad. Yes, so what should I do? Kelechi anesthesia. What should I do? Your network is so bad. So what I can do, my dear? That's okay. Confident. No. No. One word substitute. Assured? No. I'll give you 5 words. One word, like you can use any word of them, any such word you can use. Okay. There is no doubt in my mind that you are following the suggestions. But that is not enough. Like that. So now give me one word. I'm giving you, 7 at the count of 7. 7, 6, 5. Obvious. Certain. Not exactly, almost. Yeah, you can write the adverb here. Undeniably, write down. Write down. Undeniably. Undoubtedly. Irrefutably. undeniably, undoubtedly, irrefutably. These are enough for now. Undoubtedly, undeniably, irrefutably. Write down. Next. Next, number 6. Number 6. It could be well that. It could be well that, or it could well be that. It could well be that. Okay, it could be well that. It could well be that. Next. So that's it. It could well be that. Number C. Number 7. So you can write the sentences. I would say that. I would say that. Or another one. Number 8. What I mean is. What I mean is. What I mean is. Next. Nine. What I meant was. Let me put that in another way. Let me put that in another way. So these are some points. Okay. So here you can see there. You can write your own sentences now. Come on, write down. Write down. Active. Yeah, please write down your sentences. So 4 responses. Still 4 only. So use these phrases and write your own sentences. If you practice now only, you can use them in the next sessions. So 6, very good. Yeah, 6 sentences, very good. Yeah. What I mean is your heart has enlarged to a point that is not able to pump sufficiently. What I mean is your heart has enlarged to a point that it is not able to pump sufficient. Pump what sufficient? Pump what? It is incomplete. Pump sufficient. Pump what? That is not clear. Right. There is no doubt, Rubina, capital letter. There is no doubt in my mind. Some key muscles are not working. Undoubtedly, what you are experiencing are the side effects of the new medication. Very good. Rubina, I would say that you have improved a lot. What about others? Okay, everyone is tired, I think. That's so that we should call it a day, I think. Okay. So, Shalu, Shaila. Right. So I'll give you yeah. So what I mean is that you're going to be booked for sonography. Full stop. I would say that you have improved a lot. Correct sentence. Right. $11. 2 more sentences, patterns we'll learn. Let us see if I can explain myself better. Let us see if I can explain myself better and you give a further explanation. Let's see if I can explain myself better. Number 12. The patient is not ready to understand or listen to you. Then you use these sentences. Let me try to explain that in another way or method or manner. Yes. So it's almost 11. So dinner time. So now the last point is for you. Okay. Please rate the session from 0 to 10. Okay. So 0 if unnecessary, 10 if most useful, if beneficial. So you can rate any grade in between. And give your feedback in 2 sentences, 1 or 2 sentences. Give your feedback in 1 or 2 sentences. So if you practice like this every day, so from tomorrow what we'll do is, tomorrow I have exam students day after. So I'll be a little busy. Otherwise, evening class I'll be taking like this. So tomorrow's class will be speaking also. Tomorrow's class will be speaking also. In addition to writing, speaking also. I'll call you one by one and we can give one sentence each. You can write 1 or 2 sentences. How we can improve these sessions? Give me your suggestions. How can we improve these sessions? Give me some suggestions. Is this okay, or do you want some changes, or do you want more time? Do you want more practice, or do you want me to correct? I'm already correcting orally, but I'll correct in written format also. Okay. So if you follow it and come regularly. Yeah. So write 1 or 2 sentences. Dr. Kamlesh, unmute.
Sir,
Yeah. So tomorrow and day after tomorrow. When is your exam?
This Saturday, sir.
Saturday. So how many days are there?
3 days, sir.
3 days. So do you have off for these 3 days or only one day?
Off, sir. I
So
took
very
leave, sir.
good. So these
Yeah,
days,
I've applied.
be with me, contact me, and every day take speaking sessions. Okay?
Sure, sir.
Every day take speaking sessions, morning and afternoon and evening. So first preference will be given to you because you are a regular student and you have exams. So don't hesitate in asking me. Okay?
Sure,
Don't
sir.
hesitate in asking me. There is one Dr. Farid also. I think he's a busy man, so maybe he will not be available. Otherwise, I would have told you to take some speaking sessions with him. But this is not the time because you have exams. So you can contact me straight away and you can do 2 speaking sessions in the morning, 2 speaking sessions in the afternoon, 2 speaking sessions in the evening. And the others can call me at least 1 speaking session per day. Okay? 1 speaking
Okay,
session per day. So don't forget, Vinci Moore, okay, he's a regular student. And tomorrow you will get in the morning one writing correction. And if you have any doubts for writing, sorry, reading and listening, you can send me the questions and I'll explain. Next one, regular students. I told you, no, only regular students will be following up. So now I'll be asking you some questions, Kamalesh. Unmute.
Sir.
Respond to my questions, okay?
Yes, sir.
So, Dr. Kamlesh, are you comfortable? I am opening up your video, okay?
Yes, sir.
Be comfortable. So, show video panel. Yeah. So, Ruth, why did you open your video? I did not ask you to open your video, Ruth. Huh? Unless and until I ask you to open, you're not supposed to open, right? Yeah, Mr. Kamlesh,
Sir.
you can show your video. Yeah, it's on.
Sir.
Very good. Yeah, that's fine. Dr. Kamlesh, we are going to do one small session, something like this. I'm just. Yes, Dr. Kamlesh.
Sir.
Okay. So, ready. So we have some points here to discuss. Others can be doing their work. Yeah. Others can be writing your sentences or whatever it is, whatever you want to do. Yeah. I will be asking and you will be using these phrases. Yeah, Dr. Kamlesh. I don't understand what you are telling. Why is it important to take these insulin injections?
Let me explain you regarding the importance of insulin first. It is a medication which helps you to keep your blood glucose levels under control. So in order to maintain a healthy, healthy lifestyle, your blood glucose is essential. And so to prevent the complications of your high glucose, let's say like ketoacidosis, which you have been experiencing, the symptoms. So to prevent such complications, it should be kept under control by insulin.
Okay, right. Doctor, how long should I wait for you? It's been 15 minutes.
I'm sorry. I'm sorry for the condition for the suffering, I can understand your condition, but let me say I'm sorry. I'll make it up to you. So tell me what brings you to the hospital today?
Explain the reason why you are late. Just saying sorry will not help. No?
Okay, sir. I'm sorry that I've gone to an emergency surgery. I apologize for the delay.
Inconvenience.
Yeah. So now can you tell me what brings you to the hospital today?
Why, doctor, are you giving me, why are you forcing me to stay in the hospital? I am a housewife, and I have my children, my husband, I have to cook for them. And of course, I cannot relax and sit here. I can manage at home. You can send some nurse to check me out. Okay, if anything serious is there, then I'll come to you. But let me go home. No, why are you forcing me to stay? Why are you asking me to be under your observation for another 24 hours? I don't think that is important. Let me go, doctor.
Okay, I understand your concern. Let me tell you a bit regarding your condition. We don't usually keep the patients in the hospital. There is a valid reason. Because your condition is critical, you need to sort out your priorities. As your heart condition is not quite good, it is better for you to stay in the hospital and be under observation. That is the best line. That is the best thing for you. And you can, it would be helpful if we go and speak with your family and explain the condition so that they can understand what the reason behind your hospital stay.
Yeah, fine. So tomorrow we are going to take speaking sessions like this. I will give a question and everyone will be asking. So now tomorrow, how the session will be, I'm going to give a rehearsal now. I'm going to give a rehearsal now for what we are going to do tomorrow. Okay, let us see. First, tomorrow we'll start with a session. For example, there's a question like this. Okay. So this is a question I'm giving you. The question, sample question. Okay. What is the sample question? What are the side effects of let me know if there are any side effects of this medication, or what are the side effects of these medications? Okay, will I have any side effects because of this? Will there be any side effects? Will there be any side effects because of these medications? So this is the question. Get ready, everyone. Get ready, everyone. Okay. All of you be ready with this question. Okay, all of you be ready with this question. Yes, one by one, I'll be shooting off the question. Be ready. Anybody I can ask anytime. So yes, let us start with the Kamlesh first. I'm keeping unmute everyone. So when I take the name, you can unmute and start. Yes, Kamlesh. Will there be any side effects because of these medications? Yeah. Kamlesh.
So now you can hear me, sir.
Yeah, now I can hear you. Yes. Will there be any side effects of the doctor? You have prescribed so many medications, but I don't know what is going to happen, and I'm scared about these medications because never in my life I have taken medicines or tablets or injections. First time I'm facing this problem. I want to know this This is my worry. Will there be any side effects because of these medications?
Yes, of course, there are some side effects. Now we will discuss one by one what are the side effects of the medications which we have discussed already. So first things what you can witness is you might have some nausea with all the medications and you might feel some irritation of your bowels. So coming to the pain medication, first thing the painkiller might long durations, let's say in your case for a month or so, it might injure your kidney. So that is your worst case scenario, but we have kept the dose to low normal. And the second medication, the insulin, should be maintained at a critical level, so that your blood levels will not go down, and so that is the hypoglycemia can be encountered. So these are the two major side effects you can witness, and you should be aware of this.
Very good. Next, Dr. Farid. Dr. Farid is also a regular student. Yes, Dr. Farid.
Yes, about the side effect.
Yes. So you have given me these medications, these medications. Well, I want to know if there will be any side effects because of these medications.
Yes, this yes, these medicine have some side effect, and the side effect is obesity, and second, there is the obesity, and if we use in the long run, and it can cause the ulcers. So we have to take care about these things once if the symptoms started, like, so you have to inform me.
Yeah, that's fine. Next, Rajya Lakshmi. Rajya Lakshmi. Rajya Lakshmi. Okay. Sajan.
Yes, sir.
Yeah, Rajya Lakshmi. Yes, yeah, you can tell me. Rajya Lakshmi, the doctor has given these medications. I'm a little bit worried because I never took such medications. I don't know what type of medications and why you are giving this. I want to know only one particular reason. Will there be any negative effects because of these medications? Because I don't know what complications will arise in the future. I don't want to risk my life. So can you please explain me why?
Your question is reasonable, and I will explain you detail regarding the medication. It will get more side effects will be present. You have to closely observe to the and any symptoms is presented after taking the medication, or you are getting any giddiness and taking injection site in the any redness, swelling, itching, anything it is presented immediately, you can these all it will be effective while taking the insulin injection. And you have to focus on the you will gain the you will get the weight gain will be present. And then one more side effect will be constipations also, it will be present. So these all it will be effect to the your kidney damage. So you have to observe these all the things, and when you are visiting, you have to be carefully observe and to be informed.
Yeah, that's fine. Thank you very much. Next is Sajan. Yes, Sajan is a regular student. Rajya Lakshmi is a regular student. Yeah. Sajan.
Yes, sir. Yes, sir.
I came to this hospital. The doctor tested me something, and he ordered me some. And he told I don't know what the name of the disease also, and he gave me these medications. I'm a little bit worried. Can you please tell me, clarify my doubts? Because I think that because of these medications, my health will go down in the future, and I may face some complications in the future. Can you please tell me?
Yes, yes, sir. Well, Mr. John, your concern is reasonable, but let me assure you that there are some possible side effects there, like giddiness, nausea, headache, and vomiting. Don't panic about it. It will be subside within a short period of time because these medicines are scientifically tested and clinically tested and scientifically proven medicine. So don't panic about your medicines.
Next, Binsimol Thomas. Binsimol Thomas. Okay, regular students, I want you to respond, okay? I want you to respond. You are regular students. Because of you people only, I'm taking this class. Whether others respond or not, whether they get time or not, I don't mind. But regular students must respond, please. Especially the new students. For you people only, I'm doing these sessions. Okay. Binsimol Thomas, yeah, nurse. I am scared of these medications. These many tablets and these injections. Why are you giving all these things to me? Till now I am fine. Suddenly you are putting chemicals into my body, and in future maybe my body will become full of chemicals. And every day I take these medications. I don't want to risk my life. Can you please tell me why I am taking? I don't know why. What's the reason for this? Can you explain what is the importance? Why I should take this medication? And what are the possible side effects of these medications?
I can understand from your words that you are a little panic about this medication consequences. But let me explain to you, this medicine is giving to reduce your blood sugar because of the condition diabetic mellitus. And if you are taking this medication continuously, some people, they are getting, I mean, their blood sugars are suddenly falling down. So some are feeling kind of giddiness and all, but I will explain to you. If you think about the benefits from the medications, it would be good for you in the future. So better to continue the medication till the next visit. And if you have any kind of difficulty, you can approach to me so that we can give you the proper guidance.
Okay, next, lastly, Venkatesh. Venkatesh is a new student. Hello, Venkatesh.
Hi, sir.
Yeah. Venkatesh, I don't know. I'm a little bit scared about these medications. I don't know the reason why the doctor has given. Is he crazy? So many medications he's giving, and I never had any tablet, even one tablet in my life, and I never visited a hospital. Of course, I had a problem, and I come to the. It doesn't mean that you give so many medications. First of all, tell me why I should take all these things. Give me a clear picture, please, because I don't want to risk my future.
Yes, sir. I'm about of your condition regarding your consent, and you have some problem because of you some diabetic. That's why you are consulting the doctor. They are writing you on disease condition in diabetic medicine. It is reduce slowly, gradually reduce your sugar level. Then you gradually drop, decrease in the decrease in the your medication. And then if it is effectively most diabetic medication, uh, uh, loss of weight also, it is affected more in renal effect. Sometime also it is more affected in the okay, sir.
Right, that's very nice. Okay. So this is how our sessions will go from tomorrow onwards. So before leaving, okay, write your comments. Write your comments, how it benefited you. Don't tell about the session. I graded the session already and gave me the suggestion. That is different. How you got the benefit. So what benefit you got? So what benefit, how did you benefit from these sessions? How did you benefit from this session? Okay. So answer that question. How did you benefit from this session? 1 or 2 sentences you can write, and that will be the end of the session for today. Yes. How did you benefit from this session? Thank you for attending the session. It's great having you on this platform, and attend regularly and improve your quality. You're 7, 6, 5, 4, 3, 2, 1. Done.